So moving on now to our next speaker. Our next speaker is Carmen Byker Shanks, and Carmen's goal is to shape healthier communities through transformative nutrition and food system policies. And she's doing that as a principal research scientist at the Center for Nutrition and Health Impact. She's a leader in public health nutrition research, and her work focuses on 4 key areas. Dr. Byker Shanks, or Carmen, is co-project director of the GusNIP Center. That's a really long mouthful. I'm not going to say every word of that one. And she oversees national evaluation efforts and provides technical assistance to nearly 200 produce prescription and nutrition incentive projects in the US, which is, I can't wait to listen to this one because we have nothing like that in Australia. So please listen up to Carmen as we listen to her wonderful presentation. Thank you, Carmen.
Thank you for the kind introduction. Can everybody see my screen properly? Great, thank you. Okay, so it's morning here. So good morning, everyone, and good afternoon or evening, late at night to many of you. Thank you for having me. And today I'll be talking about policy-driven strategies to promote fruit and vegetable intake in the first 2001 days. So I'm presenting on behalf of the Center for Nutrition and Health Impact, where I work as a principal research scientist. We're a national nonprofit based in the US, a research institute, and our work focuses on advancing food and nutrition security, supporting healthy eating and active living, and strengthening local food systems. We also specialize in measurement strategies, helping programs document their impact. We work in the US and globally. So please connect with me if you're interested in working with us. So here's what I'll cover with you today. First, I'll talk about fruit and vegetable consumption policy as a lever for change among this age group. And then I'll hone in on a US specific policy, a program called GusNIP. And finally, I'll bring you on a closer look at GusNIP's produce prescriptions projects that have a focus on children. So 20 minutes goes very quickly. So I'm thinking of this presentation as wide, but not deep. And that's where I'd love to connect with you afterwards if you have questions. So as many of you know, fruits and vegetables are central to solving the world's most pressing child health and nutrition issues. They provide essential nutrients that support healthy growth and development. Ensuring that young children have access to and consume a variety of fruits and vegetables is really a public health priority. And it's a public health priority because there's a global shortfall in fruit and vegetable intake among young children. Globally, I don't know where the top bullet, there we go. Globally, nearly half of 6 to 23-month-olds in 64 countries ate no fruits and vegetables the prior day. In the US, 1/3 of children ages 1 through 5 ate no fruit and half ate no vegetables on the previous day. So this truly is a public health priority across the globe. And similar data is reflected for adults. When we think about why children, mothers, caretakers, families struggle to get enough fruits and vegetables, there are real challenges that vary by context, cost and affordability, limited access or transportation, time and cooking skills, perishability, storage challenges, taste preferences, and cultural foodways, and of course, competing household priorities. There are also supports for these challenges that we know about from both research and practice. Financial incentives, so ways to support food insecure households with finances to purchase fruits and vegetables, is what I'll be talking about today, which addresses cost and affordability. There are other supports that exist, improved retail access to stores, markets, food delivery, convenient formats of fruits and vegetables, frozen, canned, pre-cut, cooking education to increase nutrition literacy, culturally relevant foods and messaging, and supporting families to be role models, as well as having social support in society for fruit and vegetable consumption. These are just some examples of challenges and supports, and I'm sure in the work that you all do, you know, many others exist. In my own research, which focuses on families with limited resources who are food insecure, caregivers frequently tell me things like, I want to eat healthier and lose weight, but healthy food is so expensive. That sentiment is echoed again and again, as you can see with the quotes on this slide. It shows us how central affordability, access, and really the larger structures around those things are to increasing fruit and vegetable consumption, and not just the individual motivation to eat fruits and vegetables. So policy has a really critical role in shaping the systems and infrastructure that influence fruit and vegetable consumption. It provides a framework for creating environments where healthier choices are easier, more affordable, more convenient, more appealing, all of those things. When we think about policy, we can view it as a set of interconnected levers that can be activated to motivate meaningful change. Some of these levers include economic incentives and disincentives that influence affordability and access and the challenges that, that arise from those. Institutional food policies that shape what children and families encounter in schools, childcare, and other settings can act as a lever. Educational initiatives that build awareness and skills, marketing and labeling strategies that guide consumer choices to fruits and vegetables, agricultural policies that determine what gets grown and how it's supported in the market. The built environment and distribution systems affect availability where people live, work, and play. Healthcare approaches that integrate nutrition into prevention and treatment are increasingly popular in the United States and across the globe. Trade policies that influence supply and pricing on a global scale, and research investments that generate evidence really for what works around policy levers for fruits and vegetables. While all of these levers are really important, today I'll be focusing primarily on economic incentives as they present one of the most powerful tools we have to really influence the supply and demand sides for fruits and vegetables, and get at those barriers and challenges that families face. So when it comes to economics, there are two distinct policy levers. Food policies can draw on the carrot approach, where consumers shift choices to gain an incentive, and that's usually financial. For instance, WIC is a program in the US, Women, Infants, and Children. It's a social welfare program that provides food packages for many times food insecure, but definitely meeting income eligibility criteria. And within that program, there's an incentive provided along with the food package, which is an extra voucher to buy fruits and vegetables. And the goal is to increase fruit and vegetable consumption in that group. Or food policies can draw upon the stick approach, avoiding loss through a disincentive. So for example, taxing sugar-sweetened beverages has been shown to decrease sugar-sweetened beverages in the market. To drive fruit and vegetable consumption, most successful US policies have used the carrot approach or the incentive approach. So financial incentives can take many forms: a voucher, like I said with the WIC example, a rebate, so something like a coupon, tokens or automatic discounts at the register. They're especially impactful for food insecure households because they enhance consumer choice and they increase purchasing power at the same time. By contrast, disincentives like taxes or penalties on specific food really restrict food food choice, and it can disproportionately so for people that have difficulty affording food, so for food insecure families. Financial incentives for fruits and vegetables are not new in the US. They're rooted in federal farm bill policy. In 2008, Congress funded the Healthy Incentives Pilot, which was a randomized trial with giving incentives to 7,500 SNAP households. This was so successful that in 2014, Congress scaled this up through the FINI program, investing $100 million over 5 years into granted projects across the nation. And then in 2018, the program evolved into GusNIP, the Gus Schumacher Nutrition Incentive Program, with $250 million over 5 years. One important point, incentives require ongoing political will. As you can see by the photos on the slide, what's remarkable is that this area has enjoyed bipartisan support across 3 different administrations with really different political leanings. So that's really rare in today's political climate. There's been a lot of rallying around financial incentives for fruits and vegetables as a solution to food insecurity. So I want to go now into GusNIP a little bit more. It's a nationwide initiative that funds nutrition incentives and produce prescriptions. Nutrition incentives work directly with Supplemental Nutrition Assistance Program participants, which is our social welfare food program. And produce prescriptions work through healthcare. And they're both financial incentives to help individuals who are food insecure purchase more fruits and vegetables. There's also a National Training Technical Assistance and Evaluation Center. And at CNHI, that is what I am the co-lead of. And the goal of that is to evaluate the impact of these projects nationwide. And this is our 6th year doing so. So what we're seeing in GusNIP is really exciting because of the evaluation that we're doing with all of these projects who do grassroots implementation locally. There are increases in fruit and vegetable intake, improvement in food security, and we also do an economic impact analysis, and there's a generated economic impact in communities. So we see it as a triple win for farmers, retailers, and consumers. Since 2018, GusNIP has grown by leaps and bounds. So for instance, 773 food retail outlets accepted incentives and prescriptions in 2019. And in 2024, 5,292 accepted them. So it's year after year, it's amazing to see the growth with this policy generated program. Participation is expanding, and as you can see here, the impact is measurable. One farmer put it simply, for us farmers, the program has been incredibly rewarding. It has allowed us to support more families in our community while increasing our sales. Today, though, because of the focus of this webinar, I want to zero in on the produce prescription component of GusNIP. These are food as medicine programs, if you've heard of that term, where patients are screened for food insecurity and diet-related health conditions. If they screen positive, healthcare providers refer them into the program. Participants then receive funds through a prescription for fruits and vegetables. And these are redeemable typically at local food outlets like farmers markets, grocery stores. Sometimes there's a market at the clinic. Produce prescription programs look a little different depending on the community. Some provide funds via vouchers, some cards, some digitally, and also where folks can redeem their prescriptions also varies. So again, the grocery stores, farmers markets, and hospital-based food markets. Right now, most programs focus on fresh fruits and vegetables, and while some focus on frozen or canned options as well to better align with culture, seasonality, and accessibility based on where the organization works. So let's zoom into how GusNIP specifically supports children and their caretakers. When we look across 69 current grantees, about 35% are engaging children and their caregivers, including pregnant people, toddlers, and households with kids under 18. Programs often prioritize families enrolled in social programs like SNAP or WIC, as well as across cultures. So there's definitely a cultural focus depending on community. There are food insecure households are enrolled, and within that, 42% or 10 grantees specifically have a direct focus on the first 2001 days, pregnancy through age 5. While many programs touch on pregnancy and early childhood in some way, the clearest concentration and activity is around pregnancy and maternal health, with an intentional bridge into newborn and early childhood outcomes. These child and caretaker focused projects really vary in design. So again, the prescriptions can take many forms, and they are done at different locations, farmers markets, grocery stores, clinics. The prescription size can vary from $45 to $100 per month, and sometimes that's scaled based on family size, and it lasts for 6 to 12 months. Some programs go further, offering condition-specific produce, childcare or transportation supports, bilingual navigators, and culturally tailored produce boxes. Another key feature is education and engagement. So programs may include cooking demonstrations, farm tours, culturally tailored workshops like sofrita and pickling, or traditional food education or recipe workshops. Other supports include bilingual text messages, recipes, nutrition counseling, and even patient advisory boards to help co-design programs to truly meet a family's needs. So these programs are rigorously evaluated. I put lots of measures on the screen that you can look through. I won't read them all, but they really range from looking at improvements in dietary intake, health metrics that are specific to families and children, healthcare outcomes, so medication changes, health changes. Some programs look at family togetherness and have found benefits, also looking at the household context, like what are folks facing in their household. We at the NTAE Center, we work with grantees who have produce prescription projects to design their evaluation and tailor it to their own community. So let me give you 2 quick examples. In Central Texas, a program reaches pregnant people in Ascension Seton prenatal clinics. Families receive bi-weekly home delivery produce boxes through 6 months postpartum. Maternal health navigators provide education, link folks to resources, and make sure that the foods are culturally tailored that are provided. The program aims to improve maternal and infant outcomes like gestational age and birth weight, while also supporting a sustainable insurer-supported model. In Boston, food insecure families of pediatric patients are connected through Project Reach. Here, families receive a prepaid Fresh Connect card usable at retailers, farmers markets, and mobile markets, helping reduce, the card really helps to reduce stigma because folks aren't just like passing a paper voucher to the cashier. As of August 2024, 117 families have been enrolled, a sign of strong engagement. Early results show families not only use the benefits, but also reported improved food security, family wellness, and reduced stress around food. So I wish I could go into so much more, but I know my time is almost up. As we've seen across GusNIP programs, the policy framework here is really strong. And success, I'll say, depends really on how we and programs adapt and innovate locally. In the GusNIP example, grassroots community organizations are drawing upon a national policy to tailor to specific populations struggling with food insecurity. In this case, mothers, caretakers, children's, and families are part of how these projects tailor and really zoom in on a population in need in their local area. When it comes to produce prescription programs that focus on children, this means going beyond simply making fruits and vegetables available. It requires ensuring that they're accessible, affordable, culturally meaningful to families is really critical. Programs that thrive are those that anticipate and withstand disruptions in their local community, whether that's supply chain challenges, rising costs, or household level barriers such as transportation, or the competing priorities. So making the programs workable for mothers and their families. They also work intentionally across both sides of the food system, supporting families with incentives and prescriptions to increase their purchasing power while also simultaneously strengthening local food retailers and growers with resources to sustain their supply. So this policy lever is really about reaching families where they are in ways that are sustainable, practical, and lasting, to focus on the challenge of fruit and vegetable consumption for food insecurity specifically. And then this brings me to the bigger picture. The evidence from GusNIP shows that well-designed, well-supported policies can really move the needle on fruit and vegetable intake, food security, and ultimately health outcomes for children and families. But we all know this need is global, and not every country has a policy like this one. We know that children everywhere are falling short on fruit and vegetable consumption. So my call to action for this group is to invest in research and support coordinated public policies in your own place that make sense for making fruit and vegetable choices accessible, affordable, and appropriate, starting in pregnancy and continuing on. Because we all know the earlier we start, and I think this was noted by Brenda as well, there's an impact that lasts across generations. So just wanting to acknowledge the funder, which is USDA, my amazing team at the GusNIP NTAE, and gratitude to the produce prescription grantees who go above and beyond to serve their communities. I get to highlight their amazing work. And special thanks to the grantees and my colleagues who helped in supporting this presentation. So let's continue this conversation, and I'm looking forward to the Q&A. Thanks, everybody.
Fantastic. Thanks, Carmen. I still feel energized. I still feel really encouraged by that. I feel like that's just one big good news story, and really optimistic. And I'd love just to be able to take that blueprint and apply it here in Australia, where we've got nothing like that. But I feel, I feel encouraged that it could be done one day. Thank you, Carmen.